Hey all, this is the last podcast on the FAST exam series. This will be on cardiac. Hope you all enjoy it. So you can use either phased array or curvilinear for this exam. If you're doing Subsite Void, you can use either one. Might be a little harder to get for patients obese, etc. Parasternal long axis though, phased array is definitely better. Smaller footprint, you can get between the ribs easier. With curvilinear, it's a bigger footprint and you'll get a lot of rib shadow. Makes it hard to get a decent image. You want to place it between the second or third intercostal space. If you're doing emergency medicine version, the marker will be towards the patient's left hip while the marker on the screen is on the left side of the image. And it's just backwards. If you follow cardiology rules, marker will be to the right shoulder and the marker on the screen will be to the right hand side of the picture. Here is a movie, and you can see this is a parasternal long axis, and I will mark it here in 1 second. So this is left atrium. You can see the mitral valve right here. This is aortic valve, aortic outflow tract. This is the right ventricle up here. This is pericardium. This is your descending aorta. And let me play this again. And you can see the mitral valve flopping back and forth. Oh, this is LV here, sorry. And you can see the LV is appropriate, RV is appropriate size, mitral valve slapping good. So this is a normal parasternal long axis. Let me play this once more. You can see there's no fluid either area that you can see, which I'll show you what an effusion looks like. Here is another movie, and you can see that this is a subxiphoid view, and this is your RV, right atrium, left ventricle, and left atrium. And this is liver up here. You're using liver as an acoustic window. And pericardium coming down. Um, you can see there's no fluid here. It's none up here as well, which is where you would see it if you had an effusion. So let me play this once more. And this here is tricuspid valve. You can see flopping open. And of course, this is your mitral valve right here. But again, if you're going to see an effusion, you would see it up here along this area as well as down here. And this is a normal subxiphoid view. And another movie, and this one has a lot going on. So you can see this right here is the descending aorta. This is a parasternal long axis view, obviously. This is your left atrium. Here's your mitral valve. This is your left ventricle. I don't have a great view of it. And this is your aortic outflow tract here. This is your aortic valve right here. And this is your RV up there. So you can see this dark anechoic area here, that's fluid. This is your pericardial sac right here. But you can see this large anechoic area as well. This is also fluid or blood. Um, but this is below your descending aorta, so this tells us this is pleural fluid. But this here is a pericardial effusion. It's a small one. Let me get rid of the markings and play it again. And you can see, it's a kind of a short clip, but you can see that the RV is pretty normal. It's not really, you don't see it um, compressing or collapsing, I should say, much. And the LV as well looks like it's working pretty well, even though it's really not the best picture, obviously because they got that pleural effusion in there. So, as Matt Dawson would say, size doesn't matter. You have a um, small effusion that's not really causing much issues, but you can also have large effusions that don't cause issues. It depends on how fast they accumulate. And here is another movie, and you can see this one here is a little bit different. So you can see this dark anechoic area up here. This is a pericardial effusion. You can see the pericardium down here. And let me play it again. So this is peristernal long axis view. You can see the aortic valve right here. This is the aortic outflow tract. This is your RV. And looks like mitral valve is right here. Left atrium, left ventricle. And you can see this dark anechoic area here and here. That's effusion as well as up here. Now the big thing, let me go ahead and get rid of these marks real quick. So here is another slide, and you can see that this is a peristernal long axis view. This is aortic outflow tract. Your aortic valve is right there, mitral valve here, left atrium, left ventricle. This is your RV. And if you watch right here, you'll see this RV collapsing. And as Matt Dawson would say, it looks like there's a little man jumping on a trampoline. You can see it bowing down in that RV. And you can see that there's a pretty good effusion going on there. All this up here is effusion. Down in here. So this patient obviously needs a pericardiocentesis window or whatever, but fairly soon. And another slide. This is a subxiphoid view. You can see the liver acting as your acoustic window. You can see the heart here almost floating in all this fluid. This is all pericardial effusion in here. We play it again, and you can see it just floating in there. And if you look at the RV, we mark it LV, left atrium, right atrium. Play it again here. You can see here and here the collapse. Let me get rid of most of those markings. So play it again, maybe. So you can see the RV here, how it's collapsing right here at that wall. And if you watch right here, you'll see that the right atrium is collapsing as well. So that RV almost totally collapses. So this patient is in serious need of a pericardiocentesis. Next slide. This is an IVC, and you can see that with respiration it doesn't even budge. It just stays dilated. And if you have a cardiac tamponade going on, which you can kind of see it up in here, that's what's going to happen. And see no change at all with the respirations. You should see that collapse with the respirations. Next slide. And you can see that there's a good effusion going on here. All this is effusion. And right up in here, you can also see effusion. And you can see this is a peristernal long axis view. It's kind of not the best, but this is aortic outflow tract, aortic valve, left atrium, left ventricle. Your RV's up here. And you can see that that RV is collapsing. So this patient also Good stand-up pericardiocentesis. And next slide. Let's see what this one is. Oh yeah, so you can see here. It looks like this is a subsite void view. Looks like this is a liver up here. And this poor guy's not doing too well. You can see that he has a large effusion all up in this area here. And all this black here is effusion. And you can see that the left ventricle, right ventricle are pretty much totally collapsing. So this patient, let's get this to stop, could stand, have a pericardiocentesis done as well. This is definitely positive for effusion and tamponade. And here's a still that, again, it's not the best picture, but you can see the dark anechoic fluid all up in here. I'm not the best picture drawer in the world, but this patient has an effusion. Looks like it's a subsite void that looks like liver there. So this is going to be LV. And he needs the pericardiocentesis more sooner than later, obviously. And another movie. So this is a little bit better picture of the last one. And you can see it is subsite void. This is liver up here. And play it again here. You can see that this is all effusion. This is all effusion here. And LV, LA, RA, RV. And I'll clear these marks, but you can see right in this area the RV wall is collapsing almost totally. Let me get this playing again. So look at the RV wall up here. It's pretty much totally collapsing in on itself. I'm sure this patient's not doing the best. And you can see here the right atrium is also collapsing. You see this wall right there. Looks like somebody's jumping on it. So this would be a positive for pericardial effusion. So just a quick podcast on the cardiac portion of the FAST exam. A couple podcasts that I really like. Ultrasoundpodcast.com, Mike Mallon, Matt Dawson, Mike Stone. Simply fantastic. Their explanations are easy to understand and they're just so concise and so good. 5 Minute Sauna with Jacob Avila is also really, really good. I highly recommend both those. Hands-on training, nobody better than Twin Oaks. They do both peripheral nerve blocks as well as point of care ultrasound and also critical care ultrasound, far beyond a basic FAST exam. So they're highly recommended. You can see their schedule. I have their website there as well. And give them a try. I hope you guys enjoyed this, and we'll see you next time.